If you're dealing with low back pain, you should ask yourself this question. If the treatments being given today for back pain are effective, then why is the percentage of people suffering from chronic low back pain higher today than it's ever been before? Here's an example of what I'm speaking about. This is a study that was published in the Archives of Internal Medicine in 2009. And what the study looked at was 5,000 plus or minus people over a 14-year period between 1992 and 2006. And what they identified was that in 1992, 3.9% of that population was suffering from chronic back pain. However, in 2006, and you can see it right here where my cursor is, that percentage rose to 10.2%. And they further noted that the increases in chronicity were seen in all adult ages, in males and females, and equally in blacks and whites. Here is a more recent study on the epidemiology of low back pain. As you can see, it was published in 2020. What this study did, it surveyed a database of the Global Health Data Exchange with the keywords low back pain. I'm just going to go into the summary. The researchers found that over a 20-year period up to 2020, there has been a 50% increase in the incidence of chronic low back pain. And they further expected that by the year 2050, there's going to be another increase in the incidence of chronic low back pain by 1.4 times. So it doesn't take a mathematician to figure out that there's something wrong with those numbers. If there are more people treating back pain today than ever before, if there are more treatments and newer treatments to treat it than there have ever been before, and if those treatments are effective, then why is the incidence of chronic back pain increasing rather than decreasing? I'm going to talk a bit more about that in my next video. And if you're dealing with back pain, or if you know someone else who is, subscribe to this channel and get more good information. Thanks.